Thanks for watching this webinar, which covers the new enhancements introduced to simplify the maintenance of existing patient enrolments and to ensure that the NES and PMS enrolment records remain in sync when an enrolment record is altered or changed in the PMS. To maintain an enrolment after upgrading to Evolution version 1.16, we have introduced 4 new buttons in the patient register under the Enrolment Funding tab. These are Sync, Re-enroll, End Enrolment, and Full Enrolment. For the Sync button to be active, you need to first select an enrolment status, either confirmed enrolment or newborn preliminary enrolment, the date confirmed, and the method of enrolment. If on pressing the Sync button, the PMS enrolment status and the NES status match, then the NES enrolment information will be imported and saved into the PMS, and the funding details will be derived accordingly. The Re-enroll and End Enrolment buttons will only be active for patients who have a synchronized confirmed enrolment or newborn preliminary enrolment status. When you click on the Re-enroll button, a prompt will appear asking for the date of confirmed and method of enrolment. Once these fields are updated, click Yes, which will send the re-enrolment request to NES. If successful, then the enrolment details will be updated and the new funding details will be derived accordingly. To end an enrolment, click the End Enrolment button. A prompt will appear asking for the end enrolment reason and registration of the patient after the enrolment has ended. Once these fields are updated, click Yes, which will send the end enrolment request to NES. If successful, then the enrolment details will be updated and the new funding details will be derived accordingly. The Full Enrolment button will only be active for patients who have a synchronized newborn preliminary enrolment. On pressing the Full Enrolment button, a prompt will appear asking for the date of confirmed and method of enrolment. Once these fields are updated, click Yes, which will send the full enrolment request to NES. If successful, then the enrolment details will be updated and the new funding details will be derived accordingly. To ensure the provider CPN and facility numbers remain synchronized with the NES when there's a change, a background process is initiated to synchronize the change when an enrolled patient's provider from the patient register is changed, or when the service provider's HPI number or location are changed from the staff setup. In addition to this, a new utility called the Bulk Provider Update Utility, which is located from the Tools ribbon menu, under the Patient group, has been introduced to change all patients under one provider to another provider, which will, as part of the transfer, update the CPN and facility number of any enrolled patient enrolments with the new provider's CPN and facility number. For further information about the CBF switchover and functionality, please visit our website at www.medtechglobal.com or the Insight Customer Portal. Thank you.